Okay, a couple of little things that I would, as a doctor, frequently see are patients who have shoes that are on too tightly. Their toes are crowded into the end of their shoe because that's what they've always done. So one of the things that we look at when patients come into us is, what's the wear pattern of their shoe? The wear pattern tells us quite a bit of a story, because when we can actually see where does their foot truly sit inside the shoe, it doesn't matter what size you tell us, but if we can tell that you're having toe issues or foot pain because your toes are cramming into the end of your shoe, we're going to see a couple of things. Notice the wear pattern here on Karissa's orthotics. Her toes are literally at the end of her shoe, and you can see that in the insole by the wear pattern. Also notice that in the running shoe, she's got a hole at the tip of it where her big toe is clearly making contact with the top of the shoe and wearing out the materials. So this shoe is at least a half a size too small for what Karissa does day to day. So one of the things we're going to look at is, how do we get her into the correct shoe? It's not a question of always how that Brannick device, the foot sizer, fits a person's foot. It's a question of, where does it functionally sit inside the shoe? That's an important question to ask, and to make sure that we get that right. You might be surprised at how many adults actually change their shoe size over the course of their lifetime. And the reason for that is that as we age, the shoe that we are used to as a child doesn't change much if we don't change with our growth. And most people don't think that their foot grows much, but the truth is that we actually will see foot widening and foot lengthening as the foot ages. So it's not uncommon to see that patients should change sizes the older they get, based upon what their foot is actually doing. So we're going to look at a variety of things today, features that go with those types of issues, not only selection, but also the width of the toe box and the amount of room that a person has inside for their foot.